Okay, welcome everybody to Stretching 101. My name is Claudia Zerlini, and I'm a senior coordinator with the Public and Patient Education Department here at Hospital for Special Surgery. We have a variety of programs, including webinars, lectures, and live classes. If you have any questions about any other program, I would be happy to answer those questions. Today, we are going to be discussing stretching, and I'm going to give a brief rundown of the program and introduce our wonderful speakers today. So as I mentioned, we'll be focusing on stretching, and our wonderful PTs, Vincent and Astrid, will lead us through a PowerPoint on the kinds, effects, of benefits of stretching. And then we're going to go through some guided stretches, as I mentioned. A quick disclaimer before we get started with the guided stretches. These are general wellness exercises programs, and HSS is not providing any medical care, treatment, or diagnosis by offering these programs. We encourage you to consult with a doctor before beginning any new exercise program, including the one offered here, so your doctor can confirm that it's safe for you to participate. Please understand that there's a risk of injury associated with participating in this program, and HSS is not liable for any injury that you have or may incur by participating in this class tonight or today, this afternoon, sorry. And before we get started with the brief PowerPoint, I'd like to introduce our wonderful speakers. Vincent Lapino is a physical therapist at HSS Paramus location. He graduated from Truro College in 2018, earning a doctorate of physical therapy degree. Currently, he's enrolled in the orthopedic residency program at HSS. Prior to becoming a physical therapist, Vincent worked as a strength and conditioning coach, training professional to youth athletes, as well as adults that wanted to achieve their fitness goals. Vincent enjoys running and working out to stay active. Our other speaker is Astrid de Vincent, who earned her doctorate in physical therapy from Columbia University in 2015. Astrid is a board-certified clinical specialist in orthopedic physical therapy through the American Board of Physical Therapy Specialties and graduate of HSS's Orthopedic Physical Therapy Residency. She has expertise in treating a wide variety of sports and orthopedic injuries with special interest in shoulder, hip, and knee pathology. As a certified aquatic therapist, Astrid also enjoys utilizing pool therapy as an adjunct to land-based home exercise programs when appropriate. So welcome everyone. Thank you, Astrid. Thank you, Vincent, for joining us today. And I'm going to go ahead and share my screen and we'll get started with the presentation. And let me pin. Go ahead, Vincent.
Okay. Perfect. Good afternoon, everyone. I'm looking forward to taking everyone through our Stretching 101 class. So just to get started, we're going to go through a brief introduction of stretching, benefits of it, just like Claudia was saying. So what I want to go through first is just a couple definitions that Astrid and myself might use throughout this presentation. So there's multiple factors that affect someone's ability to stretch. So when we say mobility, we are saying the ability for a joint to move through a range of motion actively, where flexibility is the ability of a muscle to lengthen passively through that range of motion. So things that can also affect someone's mobility and flexibility is the extensibility or the ability to lengthen of ligaments, tendons, joint capsule, and the skin. We can go next slide. So stretching. So when a muscle is not flexible, we consider it tight as a physical therapist, maybe your MD, a yoga instructor, so on. Some things that contribute to tightness are your posture, any possible scar tissue following an injury or a surgery, muscle spasms, muscle contraction, or overuse. And again, I want us to really highlight that stretching means the lengthening of the specific muscle tissue and the other contributing factors surrounding that. So the effects of muscle tightness, why our stretching is so key. Tightness can lead to muscle imbalances, and this is meaning some muscles get short and strong and others get long and weak. So I'd like to just take us through a quick example of a good way to think about imbalances. So a muscle has or a joint has muscles on both sides of it. So for example, if I have my elbow straightened out, I have my tricep is shortened and my bicep is lengthened. When I go into bending my elbow, the opposite occurs. Bicep gets shortened, tricep gets lengthened. So I want you to start thinking about that when we go through our stretches of what movement you're doing and where you're feeling the stretches. Other effects of muscle tightness can be pain, and this can be within the muscle itself, the joints, or the surrounding nerve tissues. And then also tightness has been shown to increase the risk of strain. So if that muscle doesn't have the ability to lengthen, it's not going to be able to meet your demand or task you're doing while you're moving. So that's why it's so important to give the muscle the ability to lengthen. We can go to the next slide. So here's just kind of, at least from the PT standpoint, some of our MDs as well, some patterns we tend to see throughout the body. It's always the $1,000,000 question: how did these occur? Chicken or the egg, was something tight and you go into this posture, or does your posture eventually lead to these patterns? So just with that example I gave with my bicep, thinking things in opposites. On the right hand side, so we have our left hand side, we have our upper cross syndrome. So this is the typical rounded shoulder position, forward head, which is very easily obtained when you're sitting all day, either work or watching TV, things like that. So what we're seeing is, on the left-hand picture, the upper cross syndrome, we're seeing on the bottom tight, it says your pectoral muscles, and on the opposite side, tight upper traps and levator. So those are some patterns that we tend to see when you're in that rounded position. You're tightening, you're shortening the front and also up top. And then the right side is our lower cross syndrome. Same pattern. You're getting this crossing phenomenon where the person has, so iliopsoas basically means your hip flexor, so right in front of your hip. And then on the back side, it says rector spinae, so that's your lower back muscles. So same thing, we get in these patterns, sitting, standing, where these muscles get lengthened and shortened, and then they adapt over time to be in these positions.
Okay, thanks, Vinny. I'm gonna take over from here. So we're gonna just discuss briefly a couple more things. One being the benefits of stretching. So why is it worth doing? It's something we're gonna recommend you try and do daily, and why would we recommend you do that? So one of the benefits is the obvious flexibility, right? So we already discussed that stretching means lengthening a muscle or making a muscle more flexible. And when our muscles are a little bit more flexible, that can result in some tension relief, especially some of these muscles around the neck, the lower back, and the hips. When they feel tight and tense, stretching can help relieve some of that tension. The second thing it does is it increases the circulation or the blood flow to those muscles. And when you have increased circulation and blood flow, that helps muscles function more properly, more optimally, reduces their risk of injury. And then lastly, stretching can be a great form of stress relief. These are stressful times for everyone, but even, without these times, it's always important to try and mitigate stress when we can. And stretching is a nice, safe way to try and incorporate that in your day-to-day schedule. Couple things that we want to make sure everyone's clear on. Stretching is not always great for everyone all the time. There are certain times when you may want to avoid stretching. The first being acute pain. This just means basically you have a new injury, or you have very intense pain in a region because you recently injured it, or there's some disruption to the tissue there. You wouldn't want to stretch through that acute pain. You kind of want to let that heal before you start stretching it. The second being a fracture. If you have an active fracture somewhere and you stretch the muscles around that fracture, you can be disrupting the healing of the fracture. So it wouldn't be appropriate to try and stretch around a fracture site. Bony block just means if you're trying to move into the stretch, you should feel this nice kind of pliable, kind of spongy motion when you're stretching. If it feels hard, like a bone is hitting a bone, it might be because a bone is hitting a bone, and you don't need to continue to stretch into that position. That's not exactly effectively lengthening the muscle tissue, and it can just cause some irritation around that joint or that bone. An unhealed wound So, you know, as Vincent said in the beginning, when we stretch, it's not just muscles that are moving, it's all of the ligaments, the soft tissue, the skin around that muscle that are also going to be moving. So if you have a wound that's not healed and you start stretching the muscle underneath it, you're probably also stretching some of the skin on the surface, and you may be disrupting some of those new adhesions that are trying to form to try and heal that wound. So it wouldn't be appropriate to stretch if you have an unhealed wound in that area. The last thing is too much mobility. So most of the time we always think about what's too tight because it's tense and it feels short and tight. But there are also some muscles in our body that may have a lot of motion already. If you already have a lot of motion, it's not appropriate to stretch it and make more motion in those muscles, because those muscles serve a purpose. And if they're too long, they can't really do their job appropriately. So you wouldn't want to stretch something that's too mobile. There's two types of stretches. Static stretching is basically when a specific position is held with the muscle on tension to a point of a stretching sensation. And I just want to take a second to make sure everyone's clear that a stretching sensation is different from pain. And sometimes it can be a little bit challenging to differentiate those two things. But throughout today, we want to make sure that as we do our stretches together, that you're not feeling pain. It should feel like the muscle is lengthening and it should feel like a stretch, but that should feel different from straight out discomfort and pain. The second type of stretch is a dynamic stretch. It's an active stretch that involves moving a limb through its full range of motion to its end ranges, and you repeat that several times. This one's really nice, especially before you're going to start any type of higher level activity or recreational exercise. Today, we're mostly going to be looking at static stretching. So there's a couple of guidelines we'll go over before we stretch together. The first one is how you set up a stretch, and we'll kind of, Vincent and I will discuss these checkpoints as we go through each stretch. But whenever you're stretching something, you know, a muscle attaches one bone and then it goes to another bone. When you're going to stretch that muscle, you have to keep one of those still. So you have to stabilize one end, and then the other end is what moves and what stretches the muscle. The second thing is whatever muscle you're trying to stretch, you really want to make sure that it's very relaxed. If it's not relaxed and it's contracted, you're going to have a tough time feeling that stretch along the muscle. So nice relaxing muscles while we're stretching. The third thing would be to check your alignment. So make sure you're not kind of doing any funny compensations with the rest of your body in order to achieve this stretch, because sometimes those funny compensations can lead to discomfort in other areas. So we always want nice neutral alignment when we're stretching. And the final thing, which is very important, is that you breathe while you stretch. So often we see people stretching and they're trying so hard to stretch that they hold their breath. When we hold our breath, we're not getting fresh oxygen to the muscles, and that's going to make the stretch more challenging. So we want to make sure we're always getting good breathing techniques in while we're stretching to bring more oxygen to the tissue to help elongate the muscles a little bit more. The American College of Sports Medicine recommends static stretching for most individuals 2 to 3 days per week, and that each of those stretches should be held at least 15 to 30 seconds. And then you repeat that 15 to 30 second stretch 2 to 4 times. The reason this is important too is many people stretch, they don't hold the stretch long enough. And we've done a decent amount of research on this to know that if you don't hold it long enough, you didn't really elongate the muscle tissue. And so you didn't really get what you wanted to get out of the stretch. So today we're going to try and kind of keep an eye on the time and really hold our stretches for about 20 seconds or so you can feel how long that feels. Go to the next slide. All right, so we are going to start to stretch now. We do just want to remind you to please listen to your body as we're stretching. If we go into any of these positions and you're feeling pain, discomfort, it's probably not an appropriate stretch for you right now. It may be that the position needs to be modified. It may just be that that's just not a great stretch for you. So please don't push into pain, and you don't need to do any stretches that you're not comfortable with. These are all just kind of some examples of some guidelines that we can give you today. And before we move into those stretches, we will take questions at the very end of the lecture, but does anyone have any burning questions they really want to get out now before we move into the more active part of stretching? You can type into the chat or you can unmute yourself and ask. Okay. So if there's no burning questions, Vinny's going to take over and we're going to start actively stretching together.
All right. So we're gonna break this up into upper and lower body. So I'm gonna take everyone through the upper body section first. So ideally, these first couple stretches you can do from sitting position or standing as well. I will be giving a couple of modifications if needed. All right. So we're gonna start off with the head, just nice and easy warm up. So we're gonna start with turning our head to the right and to the left 10 times on each side. So I want you going nice, slow, and controlled. All right. And we're trying not to move our actual shoulders. We want the movement isolated at our head and neck. And if you need to start off maybe with some smaller movements, feel out it, and then as you get a little bit more warmed up, we can go a little bit more into the ranges. Make sure we're maintaining our normal breathing through the nose, out through the mouth. Good. I'm seeing everyone in the corner. Everyone's doing a great job. Everything's looking nice, slow, and controlled, not moving the shoulders. That's excellent. All right. So I think everyone's starting to wrap up with that one. We'll give a couple more seconds. And then now we're going to work the opposite. We're going to go flexion extension. So what you're going to be doing, again, shoulders nice and stable, looking up towards the ceiling, feeling a little bit of a stretch in the front of the neck, and then bringing the head down to the ground, feeling a stretch on that back side. So again, you can do this from a sitting position, standing, whatever feels comfortable for you in this moment. And we're gonna go same thing, we're gonna go 20 times for this one. So this is just, again, more considered a dynamic stretch because we're moving through that range of motion. Our next couple, we're gonna be actually holding a static stretch. So nice, slow, and controlled all the way up and down. Perfect. As we're starting to wrap up, now we're going to work on those shoulders. So it's basically 3 movements. We're going to move the shoulders up, pinch the shoulders back, and roll them down to start. So I'll show you in a couple views as well. So we're going up, pinch the shoulders back, all the way down. I'll show you from the side, shoulders up, pinching down, and back. So we'll do the same thing. We'll do about 20 reps, just get everything loosened up. And you don't need to exert yourself on this motion. You're not trying to get your shoulders all the way up to your ears, just within the available range and back. And we're going for 20. Perfect. Looking like everyone's just wrapping up. All right, so we're going to go into one of our first stretches. So this is part of that upper cross syndrome that I was talking about previously. We're going to stretch our upper trapezius muscle, which is basically on the side of the neck. So how we're going to do this, we're all going to stretch this one together. So we're going to stretch out our left side. So with your hand, you're going to either put your hand behind your back or grabbing on maybe to a chair behind you. You just need to try to get the shoulder blade down. From there, you're going to tilt your head to the right, and you're going to look up towards the left. And then with your right hand, you're going to gently try to pull the head down. So when you're doing this, I want to make sure that you are not trying to over pull the head because it'll move the shoulders. You need your shoulders pretty still on this one. So remember, it's your left hand behind your back. Tilt the head to the right, looking up towards the left, turning the head and gently pulling down. And we're just going to hold that there. Perfect. Let's switch sides. So now it's the same thing, just in reverse. So we're going to get our right hand behind our back, tilting our head to the left, turning our head to the right. And with our left hand, we're going to grab our head and gently pull down. And you should be feeling this on the right side. A little bit of a pull. Remember, we're not trying to, overstretch or pull or stretch into pain. Just be a gentle pulling or stretching sensation. All right, let's switch sides. We'll do the same thing on the left side. So left hand behind your back, tilting your head to the right, turning to the left, and just gently pulling the head. Another modification for this, if you feel the stretch without even using your hand, that's okay as well. You can use gravity to help tilt the head down. You'll feel all that stretching on that left side. And make sure when you're doing this one that we are turning to the left. We're trying to look towards like the left corner of your ceiling. Excellent. Let's switch sides. So last one, right hand behind the back, tilt the head to the left, turning to the right, and then just gently pulling the head down. Usually I like to tell everyone your second time around, maybe doing that stretch, trying to go a little bit further into the range once that muscle loosens up. This one is great because you can do this at home if you're at work, in a chair, kind of intermittently. And we'll get to this at the end as well with a couple of the questions of frequency and all that. So now we're going to work our levator muscle. So it lives in the back. It's not as much onto the side. So you can feel this a little bit more directly behind your neck. You're going to, so let's stretch out our left side. So your left hand's going to go behind your back. Now you're going to turn your head to the right, look down towards the ground, and with your right hand, you're going to pull down the head. So I'll repeat that again. Left hand behind your back, turning to the right, looking down towards the ground, and a little bit of a pull. And remember, you want to keep that tension for the 20 seconds or so as we're doing the stretch. Make sure you're maintaining your normal breathing. Okay, let's switch sides. So now we're going to do the right side. So right hand behind the back, turning to the left, looking down towards the ground. And with your left hand, you're just going to gently pull the head back or forward, sorry. Perfect. I'm just looking on the side of the screen. Everyone's in the right position. I'm not seeing too much movement of the shoulder, which is excellent. We're just keeping the stretch local to the neck. I do suggest with this as well, as you're breathing, you can use that to go deeper into the stretch. So every time you're breathing out, maybe pulling an inch or so forward. Perfect. Let's switch sides again. So we're going to do the same muscle again, opposite side. Left hand behind your back, turning to the right. And then with the right hand, pulling on the top of the head, bringing the head down towards the ground. And again, you should be feeling this more towards the back of your neck. So some mistakes I do see with this one is maybe not enough turning to the right. There we go, perfect. And then let's switch sides. Last one for this. So we're gonna go right hand behind our back, turning to the left, looking down towards the ground, and with your left hand on the back of the head, slightly pulling down. Yeah, these are some of my favorite stretches that I tend to give with people I'm working with. Again, quick and easy. You can do this at home, at work. Excellent. So now we're going to stretch our last muscle part of our neck series. So this is our SCM muscle. This muscle runs from the back of the skull behind your ears and attaches to your collarbone. So with this stretch, you might feel this a little bit more towards the front and maybe even behind the ear. So we're going to stretch out our left side first. So we're going to take our right hand, we're going to put it on the opposite collarbone. Excellent. You're going to apply a little bit of pressure down. You're going to tilt your head, so bringing your right ear to your right shoulder, and then you're going to slightly turn your head towards the left. And this should be more localized towards the front. And remember, it's if we're stretching out our left side, your right hand is on your left collarbone. Excellent. Let's try the other side. So now left hand on your right collarbone, tilting your head to the left. So bringing that left ear to left shoulder, and then turning up towards the right. And usually with people, if they don't feel this stretch, they're not maybe putting enough pressure on the collarbone. Again, where this muscle attaches to, you need to pin down the one side that's not moving, and you're going to stretch this muscle towards the head. Perfect. And we'll do our last one on this on the opposite side. So left hand, right collarbone, applying a little bit of pressure down, tilting your left ear to left shoulder, and turning your head looking up towards the right side. Again, that's right hand, left hand on right collarbone, tilting to the left, turning to the right. So with these stretches I did with you, I wanted to break down those steps because moving your shoulder blade and head in different directions helps target different parts of the muscle versus like our generalized when we did our twisting and our up and down, that was a little bit more just generalized. So working down, okay, so now we're going to work on a thoracic spine, which is basically your mid back where your shoulder blades rest. This one I'm going to give a couple variations because there's, in different levels of people's shoulder, they might find one stretch a little bit more comfortable versus the other. So we're going to start off with the middle one first. If you want to take your hands, you're going to put your hands on opposite shoulders, okay? This one you can do again in standing or with a chair. What you're going to be doing is arching at your mid back, trying to lift the elbows up towards the ceiling, and you're going to look up with your eyes, arching the back. And I'll show you what it looks like from the side too. And this one we're not going to hold. We're going to go all the way up towards our end range and come back down. So you're going to be coming back and forth with this one. If you want a little bit of a different variation, you can always take your hands, put them behind your head, and do the same motion, but just now to get actually a little bit of a pec stretch. So if you do that variation, hand behind the head, when you come all the way up, you're going to let your elbows fall out to the side, and you're going to feel a little bit of a stretch towards the front and back down. And for whatever reason, if these are bothering you, the third, more less provocative motion would be you're placing your hands on your knees and just bending at the back. So this just takes the shoulder out of the equation. So out of those 3 different variations, we're going to do about another 10 or so. So I just want you arching the back backwards, going towards that end range and coming back. And this one is one of my favorites for neck pain, also lower back pain, especially that mid back. It's in between those 2 areas of the spine. So helping the mobility in one area can help throughout the entire body. And what's really nice about this is when you think of, sitting all day, kind of rounded shoulder posture, this is a great way just to open up the front side of your chest and also working on the mobility of your back. We'll do like another 3 or 4 more. Good. I'm seeing good variation within the group. So everyone's kind of trying out all three of those. So you got to just pick whatever works best for you. All right. So now that was thoracic extension. Now we're going to work rotation. So I'm going to give a couple, again, variations of what we did last time. So we'll start off with that middle one. Hands are going to go on opposite shoulders. Preferably this one will be better in sitting, just will kind of target the mid-spine a little bit better. From here, you're just going to twist to the right and to the left. Trying to keep the spine neutral in respect to bending back or going forward. So you're nice up and tall, thinking about maybe, you have a balloon attached to the top of your head and you're being lifted up. Excellent. Another variation, depending on the shoulder mobility, getting the hands up and twisting that way as well. A little bit more work on the shoulders and also the mid back. And then again, depending on your shoulders, you can put your hands on the knees and just work on twisting side to side through your mid back. So we're going to do the same thing, about 20 or so. And I see everyone playing around with these different positions. Kind of the way we structured this, we worked on the head first because this involves some cervical rotation. So we loosened all that up as we're working down for the rest of our body. Now, I want everyone, to take note when you're doing these. If there's any ones that you want us at the end to go over again, or like your top 3 favorite ones, to ask us questions on, we'd be more than happy to answer that. So now we're going to work on the shoulders, my last 2 stretches for the upper body. So this one's nice and simple. Your arms, let's start with our right arm first, just for uniformity. Right arm is going to be, elbows going to be nice and straight. You're going to bring your right arm across the left side of your body. The left hand's going to grab at the elbow. And what you're trying to do is just pull the elbow in towards your body. Excellent. And you should feel stretched towards that back of the shoulder. And this one we're going to hold, this one's going to be more of a static stretch. So we're going to hold this for about 20 seconds. Make sure that we're trying to keep the elbow straight. You can bend it, but you'll get more of a stretch with that elbow out extended. And also too, depending on everyone's shoulder health, you can play with different angles, right? So this might be a little bit more provocative being up, or you can go a little bit lower and get a stretch there as well. That's okay as well. Let's switch us to the left side. So left elbow nice and straight, bringing the left elbow across our body towards the right. Right hand's gonna be underneath the elbow and just pulling it into our body. And remember, play with those different angles. You might even feel the stretch in different parts of the range of motion. And also too, if you're getting any, maybe, pinching in the front, try to lower down the arm. Perfect. Let's do our last one on the right side. So elbow straight, bringing it across our body and pulling in it with our left elbow. Sorry, our right elbow, we're pulling with our left hand. Make sure with this stretch as well, you don't want to lose it by turning your torso. Spine's nice and straight, and we're just keeping the movement isolated to our arm. Excellent, switch sides. Last one, elbow straight, right hand at the left elbow and pulling it into our body. Perfect. Last one for the upper body. So I mentioned before about the pec was really important. That tends to get shortened when you're sitting in a more rounded position. So I'll show you 2 variations. There's plenty of different variations to stretch out the pec. I'm looking online right now. Everyone seems like we're in a room, so there's different options what we can do. First one, you basically take your arms up like a letter W. Bring the elbows down and try to bring the chest up and forward. I'll show you from the side as well. here, elbows down, and bring the chest out forward. You should feel a stretch on both sides here. There is another option. This might not, let me just take off this background really quick. Another option of what you can do, it would be single arm, basically at a wall. Just raise up my, if you take, and this one might be tough to see, but you could take your hand, place it on the wall, and try to walk forward while the hand is behind you. And I'll show you from this side as well. So hand on the wall and trying to turn the body the opposite way, which will help stretch out the pec. So those are just two options. I usually like the seated one better, just for ease of doing that at home. Okay, looks like everyone's almost done wrapping it up. This will be the last one for the upper body. Perfect. I'm going to turn it over to Astrid. She's going to take us through our lower body stretches.
All right, everyone. Okay. I'm gonna try and speak up because I need to be back here in order for you to see my whole body while we do these. So just let us know if you're having any difficulty hearing me. So the next stretch, we're gonna move into kind of the lower back and the lower body for this second half. The first one we're gonna do is a lumbar flexion stretch. So your lumbar spine is your lower back right here, and flexion means you're going forward. So what we're gonna do is we're gonna all sit in a chair. You're gonna have your feet about hip distance apart, so there's room for your hands to fit down the middle. And what I'm just gonna do is I'm just gonna kind of slowly roll down my spine and reach for the floor and try and stretch out my lower back. Now, when I'm here, I'm gonna make sure that my sit bones stay firmly planted on the chair, okay? So try not to come forward like this. You're gonna leave those sit bones on the chair. You're gonna reach forward. And as you hang here, try and breathe into this stretch a little bit. Give yourself a nice inhale and then exhale. See if you can feel that stretch deepen a little bit more. Inhale and exhale. And then roll back up nice and gently. Again, as always, if you're having any discomfort in your lower back or your hips, you don't have to do this stretch, or maybe just don't stretch as far forward. Let's try that one more time. So we're just gonna slowly roll down through the spine, reaching for the floor until we feel a stretch in the lower back. Then you're just gonna take a nice inhale and an exhale. And another inhale and exhale. And you should feel a nice gentle opening in the lower back. Okay. You can always do this standing. I think seated is a little easier because, as we talked about in the lecture, when you sit, it fixates your hip bones onto the chair, and then you can move the upper part of the back to achieve that stretch. All right, the next one we're going to look at is your hamstring stretch. So for anyone who's unaware, your hamstring is the back of the thigh here. It goes from the back of your knee to the back of your buttocks, and that's what we're going to stretch right now. So your hamstring stretch, if you're seated in a chair, you want to move all the way to the front of the chair. So just my sit bones are at the edge of the chair now, but I'm stable on the chair. You're going to take one leg, you're going to straighten out your knee. Ideally, your toes can point up at the ceiling, and you're going to get your knee as straight as it goes. So try not to keep it bent like this if you can. And then all we're going to do is we're going to slowly, keeping our back nice and straight, we're just going to slowly hinge forward at the hip until we feel that stretch right behind that hamstring. We're going to do this for about 20 seconds. So you're just going to hold, make sure you're breathing nice and relaxed. As you're breathing, you may notice it feels comfortable to go a few inches further into the stretch. That's perfectly fine. Again, there shouldn't be any pain. You might feel this behind the back of the knee. That's perfectly normal. And then you're going to stand back up. Let's switch to the other side. So now other leg, knee is straight, toes point to the ceiling, back is flat, and you're going to just gently hinge forward until you feel a stretch right behind that leg. 20 seconds here, normal breathing, and exhale. Do one more nice big breath like that. Inhale. And maybe go an inch further, exhale. And then gently come up. All right, one more time on each side there. So other leg, knee is straight, toes are to the ceiling, back is flat. And gently hinge forward. You may feel like you can go a little further this time since this is our second stretch. Nice normal breathing. Don't feel that you need to reach for the toes. Frequently that just turns, if you can see, into your back arching. Remember, when we hamstring stretch, we want a nice flat back. So don't feel like you need to reach for the toes. Many people feel like they need to do that. That's not necessarily part of it. And come back up, and other side again. Knee is straight, toes are up, back is flat. Gently hinge forward. Nice breathing. 20 seconds or so. Your legs should be relaxed. Perfect. Good. All right, and come back up. The next stretch we're going to do seated is for your piriformis. Your piriformis is a very small muscle that lives right underneath your glute muscle, right in your butt. So underneath the glute muscle is this small muscle called piriformis, and it can get very tight on many of us, especially if we spend a lot of time sitting. So it's important to stretch the piriformis muscle. Sometimes if the piriformis gets a little too tight, it can increase symptoms if you have any pain or anything down your leg. Part of that can be because your piriformis might be a little too tight. So what we're going to do, you can choose one side. I'm going to do my left leg. I'm going to put my left ankle on top of my right knee. If this position is uncomfortable for you, you don't have to do that. You can kind of straighten out your leg and lower it a little bit. But if you can, we're going to try and keep this knee bent, ankle on top. And then I'm just going to take my left knee and I'm going to try and pull it gently towards my right shoulder. So I'm going to move it towards my opposite shoulder here. And as soon as I get up there, I can feel a stretch deep in my glute underneath in the back of my hip. And it's a nice gentle stretch, but it does feel like that needed a good stretch. So nice breathing, 20 seconds or so. If you're having any pain in the front of your hip while you're doing this, just back off a little bit. Relax the front of the knee a little bit. Good. And then let's switch sides. So foot goes down. I'm now going to put my right ankle on my left knee. You're still sitting up nice and straight. Remember, we talked about alignment in the lecture. So you want good posture for all of this. My other foot's flat on the floor. I'm going to take my right knee. I'm going to try and move it gently towards my left shoulder and just pull up like this until I feel a gentle stretch right in the back of my glute here. Again, if you're having any pain in the front of the hip, just lower the knee down a little bit. If you're not, go for the stretch. Nice breathing. As you get a little bit more into the stretch, you may notice you can lift the leg a little higher. And if not, perfectly fine. Switch to the other side again one more time. So left ankle on top of the right knee. Nice alignment, back is flat. I'm going to pull my left knee towards my right shoulder, remaining upright. Don't roll forward as you do this. Stay nice and upright. And you should feel that stretch right deep inside the glute underneath. 20 seconds or so. Nice breathing. The leg should be relaxed. So really my arms are doing a lot of the work here. If I were to let go of my hands, my knee falls. So that's how relaxed my leg is so that I can make sure I get a nice good stretch in that glute muscle. Good, and switch sides. Last time, right ankle on top of left knee. Good upright posture. Left foot is flat on the floor. I'm going to take my hands and try and pull my right knee towards my left shoulder. Nice inhale. And exhale. Again, I feel this right underneath my glute. Good, and relax it down. Okay, the next one we're going to do is for your plantar fascia. I'm going to take my shoe off for this. So your plantar fascia is the under part of your foot. Okay, it's kind of right through here. Starts in your heel and it spreads to the base of the ball of your foot. Okay, and this muscle is often tight on people too. So what we're going to do, same position as the last stretch. I'm going to hold my ankle nice and still with my left hand, and I'm going to take my right hand and I'm going to place it over my toes of my right foot. And now I'm going to gently pull with my right hand, pull my toes back, and I feel a nice stretch right in the arch of my foot here. If this is painful, don't pull the toes back quite as far. If you can, give a nice stretch, pull back. Again, think about the rest of your alignment. Is your back nice and upright? Are you sitting up straight? Are your shoulder blades nice and back? Try not to round forward as you do this. Good. And we will relax it. We'll do the same one on this side just so we don't have to switch feet again. Take a little rest. And now again, so my right ankle is on my left knee. My left hand is holding my right ankle in place. I'm going to take my right hand. I'm going to grab the top of my foot and I'm going to pull my toes back and my ankle back until I feel a stretch right in the arch of my foot here, right on the bottom of my foot. And it's just a nice gentle stretch. If you're having any pain in the ankle or the toes, don't pull quite as hard. If that's still painful, you can hold off on this stretch. Good. Okay, let's move to the other foot. Put my shoe back on. All right, so other foot, left ankle on right knee, sitting up nice and straight. Right hand is on my left ankle to stabilize it so it doesn't move. My left hand is going to grab my toes on the top of my foot. I'm going to pull back here until I feel a stretch right at the bottom of my foot, right in the arch there. I also feel a little stretch right at the bottom of my calf. That's perfectly normal. You're gonna hold 20 seconds, nice breathing, good alignment, be sitting upright. Good. And relax it there. And then we're gonna do one more just like that. Left ankle is on the right knee. My right hand is holding my ankle in place. My left hand is gonna grab the top of my feet. I'm gonna pull back until I feel a nice gentle stretch in the arch of my foot. And breathe. Good alignment, good posture, sitting up nice and tall. This one's especially nice if you've gone on a nice long walk. Your arch of your foot might be a little bit tight. Okay, relax that down. Shoes back on. All right, the next one we're gonna do is a standing stretch. I'm gonna just move my chair out of the way. If you guys can all stand up, that would be great. All right. So the next stretch we're going to do is your gastroc or your calf muscle, right? So your calf is right here behind the lower leg and it goes all the way down into the heel. So what I'm going to do, I'm going to stand facing the wall. I got my hands on the wall. I'm going to stretch my right calf first. I'm going to put my foot behind me. Both my toes are pointing right at the wall. Don't let them turn out because our body likes to cheat sometimes. So make sure your toes are pointing forward. My right heel is going to stay firmly planted on the floor. And I'm going to gently bend my left knee until I feel a stretch right in the back of my calf. Right here is where I feel this stretch as I'm doing this. So I'm going to push into the wall and bend my knee. I'm going to hold this stretch. This feels great if you've been seated for a while or if you've gone for a long walk. Nice breathing into it. Make sure the toes remain forward. Make sure the heel remains on the ground and not coming up into the air. Let's stand up. Let's switch other side. So I'm going to step forward with my right foot now. My left heel is going to remain on the floor behind me. Both my toes are pointing forward. Hands are on the wall. I'm going to bend my right knee and push into the wall until I feel a nice stretch right in the back of my calf of this left leg. Holding that for 20 seconds or so. Nice breathing. You may feel this in the back of the knee. The calf attaches right into the back of the knee, so sometimes that can feel a little bit tight. Good. And come back up. And let's do one more. Right foot goes back. Heel is down. Toes are forward. Bend that left knee until you feel a gentle stretch. Nice breathing. Again, your legs are nice and relaxed. My hands are what's pushing into the wall. That's what's helping me achieve this stretch right now. And then we're going to switch feet. Left heel is down. Right knee is going to come forward. I'm pushing into the wall until I feel a stretch right behind my calf. One side might feel tighter than the other. That's perfectly normal. We're all asymmetrical. Shouldn't be any pain, just gentle calf stretching. The next stretch is a kind of similar position, except what we're going to do, instead of holding the wall, I'm going to put my leg behind me. What we're going to stretch right now is the hip flexor, which is just the very front of the hip here. This gets very tight if you're seated for a while. So you want to make sure if you've been sitting, it's good to get up every now and then and do this stretch. So you're going to put your right foot behind you. I'm going to have my hands right on my hips. My left knee is a little bit bent. And I'm gonna stand up nice and straight, and then all I'm gonna do is squeeze my butt on the right side. So you're just gonna do a nice squeeze of your right glute muscle, and then I feel a nice stretch right in the front of my hip here. Please make sure that you're not arching your back backwards as you do this. I'm standing just perfectly upright, normal posture, and then you're gonna feel the stretch right in the front of the hip. Okay, now let's switch sides. So I'm gonna again put my left foot back now. And my hands are on my hips. I'm standing up nice and straight. I'm gonna squeeze my left glute. Holding, and I feel a stretch right in the front of my left hip here. Feels like a nice opening stretch after sitting for a while. We're only gonna do one of each of these because I wanna make sure we have enough time for some questions after. So I'm just gonna bear with me while I move my computer screen so you guys can see me on the table. We're gonna move to some lying down exercises now. So if you have a mat or something you can exercise on, I would recommend grabbing that now. I'm just gonna move this over here. Okay. All right. So the next exercise we're gonna do. Oh, I'm sorry, I skipped one. Standing quad stretch. Your quad is the front of your thigh. So when you do the standing quad stretch, you're gonna hold onto a chair. And let me see if you guys can see me over here maybe. You're gonna bend your knee, hold it in your hand, and you should feel a stretch right in the front of the thigh here, holding that nice and still. Don't let your back arch as you do this. Don't let your knee come forward as you do this. You want to keep your knees right next to each other and just give a gentle stretch here for the front of the quad. And let's switch sides. So we're going to grab the left foot now in the left hand. My right hand is holding the table, so I'm balanced. I'm going to keep my knees so that they're aligned with each other. So my left knee is not forward. It's right in line with my right knee. Standing up nice and tall, give a pull, and then gently stretch through there. Good. Again, your leg should be relaxed. My arm is what's doing all the work. If I were to let go of my foot, my leg would drop right down to the floor. So that's how I'm going to get a nice gentle stretch in the front of the quad here. All right. So just a couple of exercises for the table. The first one is just going to be what we call an open book. An open book is going to stretch out our lower back. So I'm going to lie on my side. I'm going to bend my front leg up like this. Both my hands are forward. I'm going to use my right arm now to open up out to the side, and I'm going to try and look at this back wall here. And I feel a nice stretch right in my lower back. You're going to try and breathe through this. Inhale and exhale. Maybe go an inch further as you exhale. And gently come back over. We'll try the other side. So the other side, my left leg is going to come over my right leg now. My right leg is nice and straight down here, and I'm going to open up and I'm going to try and look over back at you guys, and I feel a nice stretch right here in my lower back, this area. Not painful, just a stretch. If it's painful, don't try and go quite as far. And you should feel a nice stretch. You might feel a stretch in your shoulder here, also perfectly normal. The next one, I'm going to lie on my back. I'm going to stretch my hip out a little bit again. So this is a glute stretch. I'm going to just cross my ankle over my knee, and I'm just going to push my knee down. And now I feel a nice stretch right in the side of my hip and in my glute. Same idea as the rest of them. Nice and relaxed, just breathing normally. My hand is what's doing the work. My hand is pushing my knee away. And breathing and relax. And we'll switch. And now the right ankle on top of the left knee. My right hand is going to push my right knee down away from me. I feel a nice stretch right in my hip as I do that. Breathe into that. These last few, we're not holding for the full 20 seconds, just so we have time for questions at the end. So make sure when you do these at home, you hold for the full 20. Last stretch is going to be knee to chest. This is going to help you stretch out your lower back. So I'm pulling one knee up to my chest. If it bothers you to hold the front of your shin, you can always reach underneath and hold your thigh. And that should reduce any knee pain if you feel any. If you're having any pinching in the front of your hip, you can relax the knee down a bit. Let's switch sides. Right leg up, pulling my knee into my chest. I feel a nice little stretch in my lower back. Breathing into it. My leg is relaxed. My arm is doing all the work. Okay. All right, guys. So that is the end of our active stretching together, Vinny and I would be happy to answer any questions you have about that. Oops, sorry. Here we are. About any of those stretches or anything in the lecture.
I just want to real quickly say that a copy of the lecture and the stretches will be available, and I will share that with everyone after the program.
Thank you. Hi, can you hear me?
Yes.
Yep.
I have a question. I have been stretching pretty much daily. I had been for a number of months. After 3 months of doing some very gentle stretching, something happened. I just woke up one day with pain in my shoulders, and I went for some therapy and that got better. And then I went back to stretching, and I've been doing some kind of like squats, just sort of semi squats with my arms out in front of me. And I've been doing that for around 3 months. And then my knees started to have twinges and then started to hurt. Is something, even I can be doing things that don't hurt, and then after some time get pain in certain areas. Is there a way to know what's not working for me before I end up in that situation?
Vinny, you want to take it? You want to? Yeah.
Yeah, I mean that's you know, I guess the answer to the question, I always tell everyone, you know, you got to start off with something, and then what might work for someone might not work for someone else. So I think a lot of just testing out the program, doing it yourself. Seems like the squats were bothering you, so maybe that might not be the best thing for the knees. But then the second part is, you know, you said you went to physical therapy. Going with the physical therapist and going over some of those stretches, exercise that you're doing, because the form might be off. That's like the second thing that's coming.
Okay.
Yeah. So, because there's tons of, you know, obviously videos online and things like that, but I'm someone that I'm more of an in-person type person. So I would suggest, you know, going back maybe to that physical therapist, your MD, talking about these things, but potentially it could be either form is off, or maybe those are not right for you, or maybe doing too much of that. So it's a hard, complex question, but those are multiple possibilities.
Yeah, it may be that I just did too much. I have a feeling that after a while, something built up, and maybe then it was because they don't hurt when I'm doing them. And those exercises still don't hurt when I'm doing them, but they're causing a stress somewhere. So I will check with the physical therapist. I thank you for that.
Perfect. Thank you.
I have a question. So after I stretch, my back feels tight. Why does that happen? Like the middle of my back, it feels very tight now.
You may be overstretching a little bit. If you try and push a muscle too far, it kind of gets protective. It'll get a little protective reaction to it that can almost make it seize up a little tighter. I would say try a little bit more gentle of a stretch, even if it doesn't feel that intense in the moment. Your body's obviously telling you it might be. So back off the stretch just a little bit. Maybe don't hold it for quite as long in the beginning until you get used to the movement. And really make sure you're breathing a lot while you're stretching, because part of that kind of spasming afterwards may just be that you didn't have enough fresh air coming in while you were stretching, and it wasn't.
Yeah, because it only seems to happen for the middle of my back. The rest of my body's fine. So I guess.
Yeah, you might be using the muscles while you're trying to stretch them, and that's going to make them seize up. So you want to make sure you're really relaxed when you're doing that stretch, in order to avoid that kind of contraction in the muscles at the same time.
Okay. Thank you.
Yeah, I was going to suggest as well, depending on what position you're doing it, you know, we offer some positions standing and sitting. So, you know, maybe sitting in a more supportive position, like what Astra was saying, is we'll let other muscles relax while you go into the stretch, compared to maybe doing that stretch and standing, and you got to turn on a couple muscles, stabilize yourself. So that's a possibility as well.
Okay, thank you.
I have a question.
Barbara has a question. Go for it, Barbara.
I'm a walker, and I found that if I don't do like 4 miles every day, but do that once or twice a week, and then the other days do maybe just a mile, I keep things feeling a lot better. But my question is, should I do the stretching before, after, or both of my walking?
It's a good question. I don't think that there's a wrong answer. I think it's good to warm up and it's good to cool down, regardless of what that might be. And that should probably include some stretching. It should also probably include a little bit of gentle strengthening work before you go for a long walk. So maybe you pick a few stretches, you do them before your walk, and then you pick a few that get tight after the walk, and do those afterwards. I don't know if any of you have any advice there.
Yeah, so it's always dependent on the person. I always tell everyone, do whatever feels right for you. Something in my head, what works for me is I tend to do more of my dynamic stretching in the beginning, in like before an activity starts, and then do my static stretching at the end once I'm actually, warmed up and my heart rate's up. So that could, that works for me. But again, it depends on, if you feel like, I tell everyone whatever feels good, you go with that. But that at least works for me and with the patients I work with.
Thank you. These were perfect for what I need. I'm
Perfect.
gonna-
Good.
So we are at time. Before we close out, I do want to just give a few extra pieces of information. First and foremost, I've shared a survey in the chat. HSS does truly value your feedback, and we'd love to hear your thoughts about the program. It's a short survey. It should take you no more than 5 minutes. So if you click on that link in the chat, you will be directed to the survey. Additionally, Astrid is leading a 4-part workshop called How's My Posture starting April 7th. During these sessions, you'll learn how to incorporate exercises and simple modifications into your daily life to improve posture and help your body function at its best. So I'll also put that registration link, in the chat as well. And before we sign off today, I wanted to just say thank you, Astrid. Thank you, Vincent, for such a wonderful program. I feel better already. I hope you all do too. And look for an email from me with those handouts.
Thank you both.
Yeah, thank you.
Thanks everyone for joining.
Thank you.
Hopefully some of you soon.
Bye, everyone. Have a great day.